Welcome to Diagnostic Imaging's weekly scan with continuing coverage of COVID-19 and the industry's response to the pandemic. I'm Whitney Palmer, Senior Editor. As imaging continues to play a vital role in managing patients with COVID-19 infection, the U.S. Food and Drug Administration announced this week that it will relax its rules around modification of imaging equipment. Many radiology devices have already been altered to function as mobile and portable systems in an effort to keep both patients and providers safe. The agency acknowledged the need for these efforts and said that it would not object to any modifications made to systems that already have FDA approval, even if the changes would ordinarily call for 510(k) or pre-market approval. Throughout the country this week, we saw the national conversation begin to turn toward relaxing the stay-at-home restrictions. As more locations begin to walk down this path, it could mean that you will see a return to normalcy with your imaging procedures and patient volumes. Are you ready to handle the influx of postponed patient appointments and scans? Researchers from the Netherlands offered advice based on their decisions in the Journal of the American College of Radiology that could help you work through the imaging volume by changing protocols, reallocating personnel resources, and managing any medical student responsibilities. But we're not out of the woods yet with COVID-19. And so far, there's been very little guidance or details on how to and under what circumstances you should image children who either have the virus or are suspected of being infected. Because there is a greater concern about radiation exposure with younger patients, an international group of experts from 6 countries, including the United States, developed a consensus document published in Radiology Cardiothoracic Imaging, giving you recommendations on when and under what circumstances you should use chest X-ray or chest CT with pediatric patients. The group has provided language that you can use for streamlined structured reporting as well. More evidence is emerging that COVID-19 is more than a pulmonary disease. There's a significant vascular component that is tied directly to patient prognosis and outcomes. And imaging can play a vital role in the detection and management of the deep vein thromboses and pulmonary emboli that can result from infection. Researchers from the Netherlands published evidence-based guidance in radiology, detailing the situations in which chest CT can be used to affect treatment decisions. And as imaging needs to continue and it grows in hospitals, so does the need for you to maintain a protective distance to safeguard yourself and your patients. Singapore General Hospital has adopted a touch me not stance, where they've employed several tactics to control viral transmission. Work groups that rotate through patient environments together, restrictions and limitations on meal times, and new patient appointment models that track a patient's arrival down to the minute are a few of their strategies outlined in the Journal of the American College of Radiology. And finally this week, Diagnostic Imaging spoke with Dr. Susan Hawley, co-director of breast services at Wake Radiology, part of Rex Healthcare in the University of North Carolina system. Dr. Hawley shared with us the experience that her clinic has had with reduced imaging volumes and how she and her colleagues have reallocated their skills while most breast imaging services have been put on hold during the pandemic. She also offered her insights on how COVID-19 could have a long-term impact on how breast imaging services are provided in the future. Here's what she had to say. Welcome to Diagnostic Imaging. I'm Senior Editor Whitney Palmer, and we are joined today by Dr. Susan Hawley, Co-Director of Breast Services at Wake Radiology, part of Rex Healthcare in the University of North Carolina system. Dr. Hawley is with us today to discuss the experience her practice has had during the COVID-19 outbreak and what the long-term impact will be based on changes we have seen to breast imaging services. Thank you so much for being with us today, Dr. Hawley.
Oh, you're welcome. Thanks for having me.
Absolutely. We look forward to your insights. To start, as you know, the guidance from the American College of Radiology and other governing bodies at the beginning of the crisis was to postpone all elective imaging studies, which included screening mammograms and many other areas of breast imaging. So given that, how has this changed the imaging that you've been conducting? Where have you been focusing your energies?
Sure. So as you say, with the onset of the pandemic, non-emergent studies have been temporarily postponed. And for breast imaging, that includes the annual screening mammogram. However, other breast imaging services are still proceeding. Women who have newly diagnosed cancers, women who have a concerning clinical symptom like a palpable lump, those women are still coming to clinic appropriately with additional measures to ensure safety, of course, and those patients are still being seen. So the guiding principle has been, as you say, by the ACR and also the Society for Breast Imaging, to postpone the non-emergent exams, the screens. However, the more urgent exams have been proceeding. That's sort of been the guiding light. There's some nuance from group to group in where exactly that line falls, but certainly breast imaging, in the more urgent scenarios is still happening.
So you say that it really is something that kind of varies from group to group, but for your group in general, where are you not necessarily drawing the line, but which services are you considering to be the ones that are the more emergent that need addressing now?
Certainly. So, patients who have already been diagnosed with breast cancer, who need perhaps additional biopsies, who need seed localization prior to surgery before they can go and have their cancer excised, those services are happening business as usual. Say with the asterisk of additional personal protective equipment, etc. The any studies that would have proceeded from screening though aren't happening currently, simply because the screens aren't happening. But suspicious clinical symptoms, patients who have things that are concerning or worrisome, come to clinic, and those are evaluated as they would have always been.
All right, so you've mentioned things along the lines of PPE and other safety protocols. What are some of the strategies that you have in place to accommodate and maximize the safety for both you and your patients?
Sure. So the measures begin from the moment that the patient enters the clinic. Even such a thing as just spacing out chairs in the waiting room so that social distancing is more possible is something that we have in place. Because of the volumes being smaller, we have been able to consolidate our clinics so that our schedules, we can really be very, very careful and mindful to, do all the appropriate studies, but in a fashion that's timed out safely for patients to minimize everybody's risk.
Right. And when you talk about the spacing out of appointments, is there a certain time frame that you have lengthened that space between woman to woman to accommodate for safety and minimizing transmission?
It's a very fluid evaluation. So certainly, even from day to day, there's no fixed number. I think, though, that as we are considering how to gradually re-enter and titrate up screening mammography, I think that that will be more of a fixed number. In that a screening exam is a consistent exam, consists of the same views, and I think we'll be able to be um, more. More easily parsed out into chunks or blocks of time during the day.
All right. Well, one thing that you have mentioned so far that we've certainly heard from a lot of other practices is that there has been a fluctuation in your imaging volume.
Mhm.
How much of an impact have you seen from the virus, and how are you addressing that drop?
Sure. So it's a very fluid situation, obviously. I mean, and with the decision to postpone screening mammograms, a large proportion of the breast imaging is now just simply not present. So the radiologists in our group, we've put our heads together, and we've, like I said, sort of consolidated our schedules. So all of us are working a bit less. But certainly, like I said, breast imaging is still happening. So breast images are still necessary and present, as you can see, here I am. But I think that that's just something that, our schedules are determined week to week. And I think that once, as groups consider and how to properly implement reopening their screening services, that again is going to titrate up and be fluid.
Now, you mentioned that you are all working a little bit less, but there have to be ways to stay busy. So, in what ways are you and your colleagues applying your skills? I know that some of you are subspecialists, and others may have other skill sets. So, how are you kind of parsing out those abilities?
Sure. So the radiologists that are pure subspecialists, I mean, when we're here, it's a busy day, it's a full day, because like I said, there are still, important problems that are happening that we need to, that we help patients with. Um, and then more generalist radiologists are able to pick up other seats. The hospitals are still busy, and there are still sick people. So chest CTs, body CTs, chest X-rays, plain films, these things still happen in the setting of this pandemic. So I think that although certainly there's just less volume overall. I think that everybody is definitely staying very focused. And I think that the time off that we maybe do have, we're trying to rest up, because certainly the backlog of screening mammography is going to have to be addressed at some point.
Well, given that, and looking into the future, like you said, the influx will happen and it's going to have to be addressed. So what kind of conversations have you and your colleagues had on strategies or tactics for working through that backlog of postponed studies once the doors do finally open back up and patients start coming in for these elective services?
Right. So I think that the the crux of the issue is that that if you've missed your annual screening mammogram, we need to be able to schedule your screening mammogram, and that takes time. So one very obvious solution that the group is going to employ, and actually we already do, is to offer weekend hours, evening hours, just to simply extend the imaging schedule as we, like I said, sort of titrate back up. And in terms of trying to help patients, with awareness and scheduling, et cetera. I mean, reminder cards for your screening mammogram, they've always been a part of any breast imaging practice. And we've simply modified them a bit just to provide some reassurance that it's not just business as usual, that we have to perform sensibly within the framework of the COVID-19 pandemic, so that we can perform breast imaging safely and reasonably as we step forward.
All right. Well, then, as we look forward over the next 3 months, 6 months, however long it takes to kind of come out of this virus, and then into the next 2 to 5 years, we've already seen this pandemic change breast imaging in ways that we never imagined. So, going forward, how do you feel that it might be changing breast services for the long term?
Yeah, it's a really good question, because obviously this has affected all of medicine profoundly. I think that probably the biggest impact in general will simply be the role of telemedicine. Um, and so for better and for worse, however, breast imaging is a subspecialty that is not terribly amenable to tele anything, other than perhaps reading a screening mammogram, a diagnostic evaluation, or an evaluation of symptoms, or performing a biopsy requires a one-on-one patient interaction. So I think in terms of breast imaging, it won't be so much the what as the how. And how we're going to be performing imaging is going to look different than it has previously in terms of additional infectious disease control elements.
Is there anything in breast imaging that could potentially lend itself to the more telemedicine route that you've thought of? Like you said, it's not a specialty that necessarily does so easily,
Right.
but is the possibility there?
Uh, you know, in the really, when you get down to brass tacks, um, the technologist and the patient, the technologist has to be able to position the patient to obtain the images. So it's just not a social distancing activity. Um, and perhaps there are some creative ways that somebody might, for example, I can imagine that this might sort of push towards something that I saw actually on your website earlier, that perhaps the giving of results via a video chat might be a more convenient and palatable way to talk to patients after a procedure. But in terms of actually performing the procedure or performing the workup itself, I can't think of a way to do that remotely.
And that certainly makes sense. Well, I appreciate you taking the time. Last quick question. Is there anything from your practice or your experience, any tips or particular details that you would provide for other practices who maybe haven't had as much experience with COVID-19 patients or with the volume of infection in their geographic area, but it might be coming and they need to consider?
Sure. I think that uh, breast imagers naturally always are trying to think of the best way to take care of their patients and expedite their care. Um, I think that in the setting of the pandemic, it's even more incumbent upon us to provide as efficient and effective a visit as possible. For example, there was a patient earlier today who had a symptom, had a complaint, and thankfully I was able to pop next door and talk to the breast surgeon, and and the patient was then able to just walk across the hall and get a consultation to help out with her breast problem. And like I said, that's the kind of thing that my colleagues, traditionally I just do all the time, but I think it's even more important, when every visit and every exposure and every sort of trip to the grocery store is really something that we are taking, that you have to really think about. So I think that the natural mindfulness and thoughtfulness of breast imagers is, just all the more necessary and all the more appropriate in this time.
Wonderful. Well, Dr. Holly, thank you so much for taking the time to talk with us this afternoon. We appreciate it.
Happy to be with you. Thank you so much.
Thank you.
Okay.